to talk about trach suctioning right now. So first thing you're going to need when you go in, these are the suction trays that we have at the hospital, they're the hard solid ones, and then normal saline or sterile water. So first thing you're going to do, obviously wash your hands, come in, introduce yourself, okay, and then the very first thing I'm going to do is I'm going to hyperoxygenate my patient. So regardless of what their SATs are, I'm going to hyperoxygenate my patient as I'm getting everything ready, because we want their SATs up at 100%, okay? The next thing I'm going to do to get ready is I'm going to make sure that my suction is on. So when I turn my suction on, your suction needs to be between 120 and 140, okay? So put it right there. And now I'm going to get everything else ready, and then I will remove my oxygen from my patient. So I'm going to, the hardest thing about trach suctioning is remembering which hand you're going to get sterile. So I'm going to open up my kit, and I'm going to take the lid off of my saline. Inside your kit, there is really only two things. There's your suction catheter and your sterile gloves. So I'm going to be watching my patient's SATs, make sure that they're okay. We're going to say that they got to 100%. I'm going to remove this oxygen. I'm now going to put on my gloves. And before I put on my sterile gloves, I'm going to remove my watch, any rings and bracelets that I have so they don't impede my sterility. Open up my gloves. When you're putting on your sterile glove, guys, don't have your hand pointing down. You want it pointing up, okay? And don't snap it. This isn't fashion show. Don't snap it because then it'll coil. I'm going to grab my other glove. You're putting on your second glove. Do not keep your thumb here. Want your thumb away so that you don't contaminate it, okay? I'll put on both my sterile gloves. Now, I'm still sterile with both hands, so I can take my suction catheter and I'm going to coil it up in my hands. Now, I know that you learn in ATI, they say to coil it around your hand, and you can. I've never liked that method because then when I'm single-handed trying to uncoil it, I tend to make more sterile errors. So what I do is I take the Cathlon, I put it in my hand like this, and then basically I just coil it like that. So basically it's looped nicely in my hand, so it's not just hanging out, and that I have the part that is going to connect to the section, the only part that's showing, okay? So like this. Now, I'm right-handed, so my dominant hand is going to be the one that I want to have control going into the trach. So what I'm going to do is I'm going to pour my sterile water. So notice I've got a sterile hand here, and now I've touched something that wasn't sterile. So in other words, my left hand has now become dirty. So I'm going to pour my saline into my tray. I'm going to grab my suction catheter, and dirty hand, sterile hand, they shall not touch. I'm going to connect it like this, okay? My dirty hand is going to be the one that controls the suction. I'm going to uncoil now, okay? And my dirty hand's going to touch the suction, and I'm just going to check it to make sure that it works, okay? And then I'm going to get close to my patient. Notice I'm coiling it again in my hand, so I'm not taking this, and it's not going to sit and hit the chest. So I'm coiling it up again, single-handed, okay? Until I'm kind of comfortable with whatever length I have in my hand. And then I'm going to insert it into the trach. When I do that, my finger is off of the suction, okay? You do not want a suction going in, you only suction coming out. So I'm going to go in. I'm going to go in, and then you're going to feel resistance. You're going to feel like you hit something. That's the carina. So I'm going to go in, I'm going to feel the carina, I'm going to pull back. When I hit the carina, they are going to cough. And your instinct is going to be to jerk your hand away. So you kind of have to know that you're going to expect it. I'm going to go in, till I meet resistance. I'm going to pull back just a centimeter, and then I'm going to attach my suction, and I'm going to slowly pull this out. I have 10 seconds to pull it out. So it's not and done. It's in there. You hit the carina, you pull back for just a second, and then I apply. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and I'm done. Now, pay attention to the base of that when I'm pulling out. So you have to figure out how you want to do it. You don't want to be paying so much attention to pulling it out that your catheter hits the skin. So some people will sit there and pull it out, and they'll be standing back like this, pulling with their other hand so that they're pulling it taut so it doesn't drop. Others will have it in there, and then they'll start to pull back, and they'll just be lifting as they're pulling back and kind of moving it so that they're up. You have to find what method is the most comfortable for you. So you're going to put it in, hit the carina, pull back for a second, and then 1. Was a little long on that one, but I pulled it out, and then I'm going to clean out my catheter, let my patient recover for a minute if I need to, and then I suction again. You want to make the most of every pass that you're doing. So you don't want to be, as one of my old friends said, it's not like starting a lawnmower. You're going to shove it in there and pull it right back out. You don't want to, as you're doing it, remember, you're taking their breath away. Like you truly are sucking out the oxygen in them. So you don't want to be sitting there going, and it taking you 20 seconds. Notice I did not do intermittent, nor did I rotate it. Reason being is we used to rotate because, and I don't know if you can see, the catheters have holes along the sides and at the end now, okay? So along the sides and at the end. The old catheters only had a hole, like one hole, so you had to rotate it so that you could suck everything out. We've got holes throughout it, we don't have to rotate it anymore. As to the intermittent suction, our RTs don't recommend it. Whatever ATI tells you is what you're going to have to know for your test. But at the hospital, they don't recommend it because if I'm sucking up, going down, and I've got a giant mucus plug down there that I finally get hold of, and I'm pulling it up, and then I let go of the suction, I've just dropped that mucus plug back down. I don't have it at the end of my suction anymore. So they recommend just one continuous slow pull up. Thank you.